thank you guys for joining us. My name is Christopher Jammer. I'm the regional account manager here in our Austin region for Airrosti Rehab Centers. And today we have with us Dr. Andrew Danielson. So for those of you who aren't familiar with Airrosti, I'm sure a lot of you who are on this call are. We are basically a team of healthcare providers that specializes in treating soft tissue injuries. So that could be anything from your head to your toes, as long as it's not a broken bone, a fracture within the bone, or a full thickness tear, which is going to require surgery. It's going to be within our wheelhouse. So a really cool thing about not only us treating a lot of injuries in clinic, we also like to bring educational series to a lot of our partners, just so we can help you be preventative and proactive in your health. So today we're going to talk about a topic and a symptom that comes into our office very, very, very often, and it is extremely common, especially right now with people dealing with the COVID situation and a majority of our people being at home and having to work from a desk that is not necessarily ergonomically conducive to their work position. So a lot of people are dealing with working from a kitchen table or a kitchen counter, in a hammock or in a rocking chair, things of that sort. So back pain can be something that comes very, very often. So just to kind of go over some statistics that are associated with back pain. So 80% of people will suffer from back pain at some point in their life. So of course, about 1 out of 4 adults will experience at least back pain at least one time in their life. So why is this necessarily so important? Because this is so common, even if you don't have an extended back pain episode, you're gonna deal with it at some point. So what we like to do is give you just a differentiation of what back pain is, how you can be preventative and proactive with it, and if things start to come up, different preventative tools that you can use to minimize those effects. So now I'm gonna pass it over to Dr. Danielson to let him dive a little bit deeper into what back pain actually is.
Okay, well, first of all, my name is Dr. Andrew Danielson. I work as a chiropractor and Airrosti provider for Airrosti Rehab Centers. And with that, I get the opportunity to help patients feel better, get rid of their back pain, 95% of the time. And then also educate. And so this is an opportunity for us just to kind of talk about some of these things that I've talked about in practice, as well as just give you a little bit of education so that you guys feel a little more comfortable about what you might be experiencing or what you might feel throughout the day. As Chris said, it's kind of a little bit of a different place in the world right now where we're not really, we're in a different environment. Or we're at home and we don't have the opportunity to, have the ergonomic setups that we might have elsewhere, or even just have a desk and a chair that is capable to kind of work out of. Some people might be working countertops, couches, different things like that. So it all varies. And so, kind of touching base on this is important. So we kind of have an understanding of what you might be feeling or how these things can progress in a way where we don't want them to go. All right. So we really want to try to prevent this from going any further. A lot of people might feel a little bit of pain in their back and kind of just write it off as just kind of one. A lot of times people use the excuse, oh, I'm just getting a little older. Yeah, I mean, that's true. Everybody, there's kind of, statistic as a certain age, things will start to kind of being a little bit of a degenerative change, but we can still stabilize and prevent things from further progressing. And that's really what we want to do. And so you want to look at some of these keys as we're going through this, okay? So this slide really specifically is just saying, what is back pain? Back pain can be any number of things, really just, in regards to the back. I mean, it can affect the lumbar spine, the cervical spine. The cervical spine is still kind of a portion of the spine. The mid-back, which is your thoracic spine. Then you got your lumbar spine, which is kind of noted here on the slide itself. The discs in between the vertebrae, which are kind of like your cushion, the cushioning that you need, that will start to degenerate too with time. So kind of having an understanding of what's going on there. The spinal cord, the nerves that are exiting out, people talk about sciatica a lot. It's a pretty common terminology that people will throw out there, not always accurate. When some people come in saying that they have sciatica, not really the case, but that's kind of what it's thinking, because it's a common terminology, right? So we're trying to give you some of this terminology right now. Outside of that, just muscle aches in these areas too. And they talk about the thoracolumbar fascia, which is just a big piece of fascial tissue, which is a big connective point for a lot of back muscles, all right? So if we had an anatomy chart to kind of point that out to you. But like I said, as you look at all those, that's a lot of things going on there. So it's something to really kind of, you know, be aware of a little bit and help us kind of take it to the next level with regards to your education. As we then move into kind of just symptoms, you know, so again, we have all this, the components or the structure then are kind of correlated back into symptoms. Now, this symptoms is really just pain. I mean, anytime you feel pain in your back, that's a symptom of back pain for the most part. It's, again, going to be a variation of different types of pains, which we need to kind of pay attention to. But you know, we're talking about the radiating pain down the leg, pain with rotation, pain with movement, pain with just sitting or standing for long periods of time. Those are all, you know, your symptoms of back pain. But and a lot of these can be correlated to, you know, poor posture or lack of exercise, and therefore just lack of mobility and lack of movement. It doesn't need to be necessarily like, hey, I'm going to the gym, you know, 4 days a week. It could just be, are you going for walks periodically throughout the day, or not, or like once a day or 3 times a week, something like that, just to get your body moving. So we're not in such a space where we're just sitting so much, as really tends to be the case. Because so this, you know, when you talk about degeneration and changes in the body, we start thinking about what we kind of refer to as creep. It's a word where things start to kind of creep into this position. And so your body is kind of moving in a direction unknowingly from poor posture. Like, so it's things like if this is a bone and this is a bone here, and then we have that disc material in between, as we sit, this thing starts to get closer and closer together. And because we're not using any stability of the core strength to give us that cushion, that extra cushion. And so this is kind of your body kind of creeping into this position, and where things start to get compressed and tight, nerves start to get pinched, different things along those lines that will start to happen. And so a lot of times back pain happens without us as kind of in the process of happening, until then it just gets thrown over the edge. So a lot of times I get people coming into the office and they're like, well, I didn't do anything. I didn't do anything that caused this. In reality, you've been doing a lot over many, you know, years. Things have been kind of making these small changes. And so now we're kind of to this point where we got to really start kind of trying to reverse the train a little bit and get us back into stability, right? So that's just kind of one perfect example of poor posture and kind of lack of movement and different things, lack of stability that start to kind of lead us into this direction. So as we start kind of getting a little more specific, we start touching base on kind of a muscular group here that is their psoas. People, it's their hip flexor primarily. It's the tilt. If you think about yourself sitting in a car chair, and the thing that kind of does the tilt or the rock back of the chair and then pulls us back up when you hit the little button, that's what this muscle does. It stabilizes your tilt. A lot of times we don't use this correctly, and it really just becomes tight because it's trying to do work unknowingly. So as we sit a lot, or if we sit in a position where actually our knees are above our hips, this will get really excessively tight on us. And what it can do is it can start pulling on that spine and creates this more compression that we don't want. When we think about things, compression is bad. So compression is something our body does not want, does not need. We want to think about ourselves kind of just riding on this air ride versus like compressing things down. We want to try to think about giving ourselves space. So anytime you think about compression, we're going to associate it to something that our body doesn't really like, okay? So this muscle specifically, when we're sitting and our knees or our hips are flexed and our knee is up above our hip, it's going to stay really tight. So then when I stand up, what that's going to do is it's just going to pull and load that spine, which then can cause this compression, compresses the facet joint, the disc, increases susceptibility for disc bulges, nerve irritation, all those not fun things that we don't want to have happen. So as we actually go into this next slide, you'll see here kind of what a disc bulge is. So this is kind of giving us a little bit of structural, kind of a little bit of a visual cue here. So the white is the vertebral body. So I'm actually going to show you just a little something here. This is just a little segment of a piece of spine, all right? So it's like right there. This is the back side. So this is the little bony prominences that you see, or that not that you see, but you can feel if you kind of run your fingers down your spine. You're kind of running your fingers down this portion of your spine. So this is the front, and these are for the vertebral bodies, and this is the disc right here. And so that's what this orange little piece is kind of dictating, the disc. So right up there on the front of the top left is talking about a disc bulge or ruptured disc. And that's due to excessive compression. Again, kind of the wrong word that we want to have associated to our body. Where that disc material is it's a fluid-filled sac that is helping to kind of absorb shock. It can be loaded really aggressively, kind of on a straight line, a linear line from top to bottom. But if we start offsetting that force, like slouching, we start putting more of the force dependent on the front of the body. And then what it does is it kind of pushes that little orange ball out the backside. And by doing that, then we get compression on the nerve now. And so this thing then kind of is a catalyst that leads to other things. So that compression on the nerve then fires up the muscles, sends the muscles into a spasm, or you get the radiating pain down the leg that tends to happen. So these are the things that you kind of start experiencing with just a disc bulge or a ruptured disc. And we kind of recognize from the slide previously that a muscular kind of imbalance as a tight hip flexor can kind of initiate this degenerative changes. The next one is just like disc degeneration. It just keeps going forward, disc degeneration, some bone degeneration. Herniated disc is kind of synonymous with a disc bulge. And then thinning of the disc is just over time. If that usually happens when you have a herniated or a ruptured disc, then the bones start to get closer and closer together, which then increases to joint degeneration. So again, all kind of nasty things we want to see if we can avoid and prevent as much as possible through just kind of a little understanding of what we need to do. So as we go into kind of the next slide, the most common kind of risks associated to this. I mean, I don't know that I'd put age as a risk necessarily, as it just age is a factor, right? I mean, because you know, as we get older, our body starts to dehydrate a little bit. And so the disc material is predominantly water. And so as that starts to kind of get a little, you know, less water buoyant, starts to become a little more brittle, it can become more susceptible to stress, external stress. For example, a lot of folks that kind of go down to pick up, you know, a big heavy box. One, they might not be bracing well, but the other part, they could just be they could be in a position where, you know, these things are just a little less buoyant and less resilient, and therefore then you kind of just a perfect storm kind of took place right there. All right. But age, at a certain point, just in regards to the clock of time, it starts to get, you know, we start to kind of all on this kind of criteria. So it's something to be aware of. So, you know, for example, you know, if we're kind of beyond this age and you haven't been in a workout routine, you want to move extremely slow going through that process. I mean, I'm talking like starting with 10 to 15 minutes of just walking. Just get your body moving. I never want somebody just to go aggressive thinking, okay, now today is the day I'm going to start and I'm just going to get out there and I'm just going to go, you know, and just really, you know, get in the gym and go after it, right? That's not a smart way of doing it. So just kind of being aware of these things will give you an understanding of how to take your time to do things. Because really, that's going to be the safest and the best way to kind of get back into some of this stuff. So that also then correlates to diet, correlates into your fitness level, you know, so again, fitness level, poor posture, sedentary, you know, we start to kind of fall into this category where we just, you know, things are not engaging and supporting our body like we need, and we fall back into that compression. Dietary, you know, we got to think about the diet a little bit. Not only is it a matter of kind of putting on excessive weight that loads the spine incorrectly, but it also has a factor of increasing inflammatory response. Too much sugar, high carbohydrates, which is kind of producing sugar. Those things are going to create a different level of pH in your body, which is going to stimulate inflammatory response. It's going to put us in a place of now we're kind of having to fight that too. So these things, again, create kind of a perfect storm of not just low back pain, but other types of pain, you know, from knee to foot to elbow, you know, shoulder, neck, all this stuff can kind of combine into one. But in regards to the topic itself, it's definitely kind of is going to contribute to some of the, you know, pain and irritation and dysfunction that can happen through the back. Okay. So as we move into kind of just, you know, talking about kind of the spine and showing you the slide specifically is really to kind of give you just an idea of how the body kind of works with each other, right? So for example, stability, the knee wants a lot of stability, but you know, the things that move more are the hip and the ankle. But also, in my opinion, those need a lot of stability too, because if those are weak in their stability, they're going to function with the knee. The knee's not going to take a little bit of a blunt load, right? The same thing then now to the back. We want the hip to move so the back can be stable. So a lot of times when folks bend over, what they do is they bend over to pick something up, they just kind of curl like this versus hinging the hip like that, kind of bending the hip backwards, being able to pick something up in that direction. So that's kind of the variation of movements that kind of getting a good understanding on will be important. But that's also that movement. The first movement is how most people react when they need to go down and pick something up off the floor, when they need to pick up something heavy. Everybody talks about move with your knees, move with your knees. But if you aren't doing it enough throughout your day, you don't recall that when it comes time to kind of actually do something. Right? And so that's then leads us susceptible to back pain. So, you know, just getting on a routine when you have an understanding of movement can be extremely helpful for us over the course of you know, our life and just kind of maintaining longevity and reducing pain, all right? So this is just kind of an overview of that. So what we're going to do, I mean, just kind of how the body works together. I think it's important to kind of have an understanding of how the body works together, because that's how we, you know, the education is how we prevent things from going further down the road. Okay, ways to prevent some of this stuff. So we're going to go into a little bit of some kind of exercises and stretching and mobility stuff. I mean, all three of these categories are extremely important for us. So stretch, strengthen, core strength, you know, is going to be a big piece. Although they show the six packs, it's really kind of the lateral core tends to be bigger. So, I mean, don't worry if you don't have a six pack. It's not, you know, it's not going to be crucial for you to kind of maintain a strong core. Okay. You know, that's got kind of a physical appearance to it, but it's not really the most functional. Really that lateral component side, the sides kind of along, you know, your obliques, internal, external obliques, those things are really going to give you a lot of help for stabilization. A foam rolling too is just, you know, it's helpful because what it does is it gets you one, body awareness. It helps you kind of palpate. Palpation is just feeling tissue. So it gives your brain and body a little bit more of an awareness that, hey, this is kind of tight. This feels tight. This feels a little, like my left side feels tighter than my right side. And it's giving you that kind of feedback. Your body wants to be symmetrical. So if you find things that are a little variable, those are the things we want to try to work out, right? We want to, like, if something feels weak on one side, we want to get it stronger so it matches the other side. If one thing is tight on one side, we want to loosen that up so the other side kind of matches that looseness. So important. It's an important tool. This will help you kind of, one, bring blood flow to the area, kind of help loosen up muscle tissue. So it has a lot of great little components. And this is just one little exercise here that we do a lot of because, one, the glutes have a tendency of being really tight but weak, okay? A lot of times because, one, we sit on them a lot. We sit on our butt a lot, and by sitting on our butt a lot, we're just we're not engaging it. It doesn't really engage. When we walk, a lot of people, as they walk anymore, they don't feel their butt actually doing any work. They feel all the weight going into the quad, which is the front of the thigh. So we're never really getting that glute turned back on, and the glute is extremely important to getting the pelvis stable, so that then the spine can sit on top of it, like it's actually like a plateau or like more of a tabletop that we want this column, which is our spine, to sit right on top of. But we don't have a strong table. We kind of missing the boat on half of the piece of stability. Okay, so first of all, by getting this foam roller and then rolling through this, you know, I'd spend 2 to 3 minutes per side at least. Trying to kind of work through some of the trigger points. So I do a big scan with the roller. I feel for kind of tender spots, and then I isolate those tender spots by just hanging out on the roller and focusing on my breathing and letting that breathing soften that tissue, down-regulate the pain. So if I get on there first, I feel that trigger point, and it's like a 4 out of 10 pain level. I want that to at least get to half before I stop or move on to another spot. So if it's a 4 out of 10, I wanted to try to get to a 2 out of 10. Or a 1 out of 10. Some people want to stay there long enough to really now it just feels like just deep pressure, but there's no sharp pain left. Hey, it's your prerogative. You can do what you need to based on the time you have to do things, okay? So think about efficiency and think about effectiveness, all right? So this is an important piece for low back stuff, all right? As we get into kind of the next one, again, it's your quadriceps and your IT. You know, for me, personally, the quadricep is really helpful because, one, we overuse the quad a lot. So the quad is usually really strong, but overused. And so by being strong, it likes to be a lot of our stability. So to kind of give it a little bit of a break and roll that and let up some little bit of tension would be helpful. What that has a tendency of doing, it has a tendency of pulling the front of the hip down towards your toes, which then compresses the low back, similar to the hip flexor that we talked about earlier, right? And so we want to kind of give that a little bit of a release so that we can then kind of allow the pelvis to kind of come back more to neutral, okay? The IT band specifically, I really just roll the lateral quad up into the lateral hip. A lot of times people feel like, hey, I'm rolling the IT band, but it's really, really uncomfortable. And so that can vary depending on what you need. If it's more of a knee issue, I might get into that a little bit more. More of a hip, I'm just going to roll the muscle of the IT band, which is called your TFL, your I'm going to really focus a lot on that lateral hip because that's, again, is going to be a big stabilizer. It's really overused. The lateral hip is because, again, the glute is a little weaker. So it kind of, if one thing's weaker, another thing has to take over. And that's always the concept. This is just kind of a part of your body. I apologize. There's construction going on. I hope y'all don't hear it, but I can hear it. So, if you do hear some banging around, I apologize for that. But so that's kind of extreme. That's another important area. So these three areas are foam rolling, glute, quadricep, IT band slash lateral hip, all going to be extremely helpful for low back pain, okay? We get into a hip flexor stretch. Now this is a standing one. I mean, this is a kneeling one, which I think can be extremely helpful but if some folks, if you're in a lot of back pain, it's hard to even just get down onto the floor sometimes. Or say you got some, you got a bum knee and you don't want the pressure on the knee. You can do this in a standing position. So what I'm going to do is I'm just going to take my chair. I'm going to try to kind of bend this down a little bit here maybe. Or take a chair, take a wall. I'm just going to pretend I'm going to use the wall. I'm going to bring one leg forward. So it's like a split stance here. I don't know if we can see this that well, but I'm going to try to kind of do that down just a little bit more. I'm going to do a split stance just like this. And what I'm going to do is I'm going to kind of rock my hip underneath me a little bit. So I'm kind of getting a little bit more of a flat back, not so much of an arched back. An arched back is no good. Again, we're compressing. If I round out just a little bit, I kind of flatten this out and I take off some of the compression in the back. Once I get that, I'm just going to bring my hips forward. The whole component. A lot of people, as they do this, what they do is they kind of start just kind of like bending that and arching that back, which all it's doing is kind of compressing here and we're not getting the real stretch. I'm going to switch legs so you can see that again from a different angle. I'm going to kind of flatten out and I'm just going to drive this whole piece forward until I can feel a little bit of a stretch kind of along that portion of my hip, kind of almost upper quad. Down here, you might feel a little bit of lower quad too if your quads are really tight. But that's going to get rid of some of that hip flexor tension that we talked about in I think it was like your third or fourth slide there, all right? It's going to release that, and we're going to be able to kind of have a little bit better range through here. And it's going to take off some compression in the low back, okay? So that, to me, is an easy one to do because you can do it standing, right? So we can do it standing and we don't have to worry about, kind of this whole getting down on the ground, and you can do it regularly. You can do it that could be your break from sitting every hour. I always kind of recommend that. I'm like, no, I don't want you to sit longer than an hour at a time. If you can kind of keep moving, that'd be fantastic, right? So that one is that's a little bit of a longer hold. It's about a 60-second hold. And I do probably 2 rounds of that on each side just to kind of make sure we get that, really kind of get a little bit of release. The thing is too, sometimes we stretch it, we don't stretch, we don't hold long enough. So, think about a stretch anywhere between 45 to 90 seconds, okay, to really get the benefits we need out of the stretch, okay? This chair stretch, super easy one. Again, all you're doing is just standing. You're going to really make sure you sit up straight, though, as you do that, so that then I can get the rotation and I can turn. And I'm just trying to get some rotation in the back, feel the back kind of rotate, feel this lateral side of the core kind of moving a little bit. So it's like right here. And again, all I'm doing is just going to sit up straight and I'm just going to kind of rotate and follow with my head, feel the movement happening and the muscles here as well. And just try to get you to kind of work through that. Again, same thing. Breathing is important. So as you stretch, don't hold your breath. Get your breathing to kind of help you, because one, we got to be able to breathe as we move. If we don't, that's going to be no good for us either. So movement is going to be helpful. Breathing and moving together is extremely helpful, okay? And then again, so same thing with that too. That should be probably like a 45-second hold, 45, 60-second hold, something like that. Do it on both sides, okay? The wall push. Now we're getting into a little bit of core strength here. So core and some glute activity, all going to be good. Everything that we do, when we start thinking about lower half exercises, that would be like, you know, core, hips, knees, everything like that. You want to think about it in your head as like a two-step movement, right? So I want to think about stabilizing as my primary step. But what I need to do is stabilize. I got to engage my core a little bit. I need to make certain that that is stabilized and ready to take on load, right? A lot of times we just go straight to movement and we surpass the, you know, the stabilizing, and that's where we get into trouble, all right? So this one is simply you're laying on the back, your feet are up on a wall, and all I'm doing is I'm kind of just pushing my feet into the wall, and I might get a little bit of pelvic elevation, so like a slight bridge, and I'm just going to get that, and I'm going to hold and brace, and I would do this like it's like a plank, which is our next exercise, but I would do this where I'd hold this, I kind of hold this for 30 seconds. I might do 3 sets of 30 seconds. Now, if you look at this, this is kind of stabilizing. This is a stabilizing exercise. And what if I took that and I just turned that person up like this? What am I doing? I'm sitting in a chair. So I'm just taking what is a functional, you know, what we're doing naturally, like an active daily living kind of thing, and I'm turning it into an exercise, all right? So that I can help you be stronger with your daily exercise, with your daily activities. So that's extremely important for us, okay? It's going to be the same thing as we look into the plank. I mean, a plank, for example, is kind of the same thing as standing. Now, granted, more aggressive, a little more effort's required because we're kind of, you know, forcing gravity. Like with this plank here, I want you to really concentrate on one. I don't want that back to feel like it's kind of arching too much below us. If you arch too much, what you're doing now is you're using your back muscles to stabilize your hips and your low back. But in reality, those should be kind of shutting down a little bit. The core should be doing all that work. As well as too, I tell most people I might start firing that glute too. So get your glute and your core to work together in this plank, and you'll find that your plank has changed and has become more difficult, but it's also more engaging, and you're doing more with your body to think about stability. I always want to think about the core and the glute working together to help for stabilization. As I said, we got to have a strong table before we can stack a pillar on top of it, okay? On the side plank, one that gets overlooked a lot, because one, it's a little more harder. I'm going to be honest. A lot of times, like, man, that's too difficult. I don't want to do that right now, which is fine. There's variations here. You can do a plank on your knees. You can do a side plank on your knees. You can make these things less aggressive, and we can still get the results out of it that we need to help kind of start bringing us back up into the kind of more engagement, a little more activity, all these things. So we can always regress this, but still get the effect we need out of it. Because as I mentioned, that lateral core group is what's going to do more for your back than that kind of anterior front, you know, rectus abdominis six-pack is, okay? So this is, I think, the side plank to me can be a little more important than the kind of a, you know, traditional just front plank, all right? So again, same thing for these ones. For you, just, you know, do a set, time it, see how far you get, and then that's your goal. That's your benchmark. Every time you either want to hit that or hit a little bit more, all right? So that's a good way to do these too. So it's not like you're setting yourself up for failure. If like, hey, I'm going to do this for a minute, but you only get 30 seconds. And then it just seems like you just failed there, when in reality, what you got to do the first time you do it is just set that bar and then go from there, okay? Pretty easy, that way. After that, I'm going to kind of pass this back over to Chris though, but you know, those are all great little easy things. You can throw them intermittently in through your day too, so you don't have to do all of them at once. Maybe, hey, you know, this is my 1 hour break, I'm going to do the wall push. Or like 1 hour, I got 5 minutes, I got 10 minutes to kind of just give myself a little bit of a head clear, get up, move around a little bit. And I might be able to throw in like 2 sets of the wall push. Or hey, I might be able to throw in a plank, you know, like 1 set of a plank or something like that. I mean, if you could truly do that right now when you're at home, I mean, this would be the perfect time to get on a schedule like that and utilize the space you have in your house and not feel embarrassed about being able to, hey, I'm going to go throw on a plank. to do that, to kind of keep yourself moving and, you know, really take advantage of this time. Let's start using this time as an advantage when you're at home versus it being kind of a disadvantage, especially for your body and your wellness and your health. And, you know, you can do all these kind of, you know, little different changes that can be helpful for you. Okay. Chris is going to leave you my contact information at the end. I really appreciate you all taking the time to step in and listen to me talk here. Any questions, though, please don't hesitate to you know, shoot me an email, and I'd be happy to get back to you. Okay. Thanks again.
All right, thank you, Dr. Danielson. And we actually have a couple of questions that came through in the chat. So for anyone else who has any particular questions, there is a chat function that you can send over the question that we can get Dr. Danielson to answer them while he's still on the call. But the first question that we have is, do you have a particular stretch that you can show everyone that can stretch the quadriceps that doesn't involve using a foam roller? So like a standing quad stretch or something like that?
Sure. So yeah, perfect. Like a standing quad stretch is probably like the easiest one. And so it's just, again, always use something for balance, because I'm not trying to test your balance here. I'm just trying to get you to really get a stretch. So, I mean, really, this is the standing quad stretch. You're just going to grab your knee or grab your foot and just try to kind of pull it a little bit closer to the butt. As I do this, I'm going to think about kind of driving that knee towards the ground. So I don't want it to kind of, so if I'm doing this, I want to kind of try to pull back a little bit without arching my low back again, right? I just want to kind of get it enough to where I feel the stretch. So right here, I feel it up a little bit higher, which is perfect for me. I mean, that's a good stretch. I don't need to go past this. If it's too much for you, don't worry about it. Just kind of play again where you feel the stretch. I'm going to bend my right knee a little bit too, just to give me a little bit more mobility. So again, I'm not arching my low back so much like that, to kind of really just give a good stretch without feeling like I'm cheating. The biggest thing about stretches is, again, the cheat aspect. Like, so for example, that hip flexor stretch, if you let your low back arch a lot, you're kind of cheating, and cheating is a way of saying, I'm not getting the pure stretch I need. I'm only getting half the stretch because I'm letting that back go forward, which is then taking tension off of that muscle group. So by pulling that back or keeping it kind of flatter, I'm getting more tension on that muscle group. Same thing with that quad stretch. If you let your hip or you let your low back arch, I'm giving it slack versus keeping tension on it. So trying to think about a flat back is going to be really helpful for those two stretches, to really get kind of I think the real benefit from it. Okay, hopefully that helps. I mean, sometimes it can be challenging because if you don't have that kind of motion where you can kind of actually grab your foot, that can be a little more challenging. And so then you start having to talk about kind of other variations of kind of laying on your stomach and actually kind of looping something around the ankle and actually pulling it kind of up over. And that's a little bit more involved, but it can be easy. And if something like that is having problems, if you're having problems with that specifically, again, I'm happy to kind of talk with you individually.
Okay, and another question that we have, I think we had about 3 or 4 questions, but I'll go through about 3 of them. The second question is, without a foam roller, how would you stretch the glutes? Or what's a really good like external hip flexor?
Okay, got you. So I'm gonna use my table over here just to kind of go through this one. This is a really good one. I mean, so like just really going into a figure 4, and it doesn't matter if you're in like what chair you're in. I'm just doing this just for visual effects. But we go into a figure 4 stretch like this, and I bring my chest up and I just lean over the leg. Again, my chest is up. This one, I don't mind if I got a little bit of an arch in my back here, because that's now going to pull my hip like backwards. So I'm getting, so my hip is going to kind of cock backwards a little bit, which is going to then give me more pull through here, right? So if I'm in this position, I want to just feel like I can kind of go this way. I can then angle myself off a little bit. So I'm rotating my chest. I'm going in this direction. I can go a little bit further with it if I need to, or I can just come back into center. I can also pull the knee towards me, or I can kind of push the knee away. And that's going to give you kind of this kind of full, motion through there. That's going to help you with regards to, just the hip in general. So it's going to give you a lot of different muscle groups. I wouldn't stay in one direction. I would definitely kind of change and alter my position with my chest, keeping the chest up again. Don't round or arch the low back. That's really important. I think it gives you that little bit of extra stretch in there, which is going to be helpful. All right. And so that, and then again, working those different angles, because your body's three-dimensional. It's not just one line. It's not one linear path. So you want to think about kind of moving yourself in different directions to help you with that.
Okay, and last question that we'll go through will be, so if you are using a foam roller, are there particular areas that you should avoid?
Sure. So, I mean, the biggest things that I give my, I give most of my patients is you don't want to be directly like on joints, for example. So I don't want to be on the outside of the lateral side of the knee or on the inside of the knee directly, but you can stay above the joint or you can stay below the joint. That's one thing that I would kind of pay attention to. The other thing is you don't want to be directly on bony prominence. So anything that kind of feels like it's kind of sticking out at you, for example, the lateral hip, you got your femur bone like right here, that's just going to hurt, right? That's not going to do you any good. It's not a muscle, it's a bone. I mean, there are things that are attaching around it, and if you're real comfortable, there's other ways to hit those attachments, but the foam roller is not really your key tool for that. So bony prominence, things like that, you don't want to be directly on it, and you'll kind of know it'll be sharp and it won't go away. It'll just feel uncomfortable. And so like I said, if it's muscle, you'll notice the volume or the pain will start to go down. As it goes down, we know we're actually making the physiological changes we need to have happen to the muscle. But if it stays the same or goes up, obviously that's a bad thing. We don't want to hang out there. We want to kind of move off a little bit. You don't have to move far. You can just move a little bit, and then that might be the right space for you. So just kind of think about kind of small movements, not big movements, as you're trying to kind of traverse, the body or the body region that you're working on. The other thing is too, nerve stuff. I mean, I'm not really as concerned with the foam roller for you in that regards, because it's a little bit broader than like a lacrosse ball or like a hard ball, but still something to be aware of. If you feel something kind of stinging, like a tingling sensation or radiating pain, radiating pain is kind of, because your muscles might radiate a little bit, but I'm talking like nerve, like it's going from like your hip down to your foot. Stuff like that then that starts to actually bark at you and get louder and louder. I want you to get off of that too. And then the third thing that is really kind of, so 4 altogether, really: joints, bony prominence, nerve type stuff, and then vascular. If you feel something pulsating, like it's not like a muscle, but it's on a rhythm, you're on an artery. And so just maybe, veer off of that. Just, it could just be like you just have to kind of angle yourself just a little bit to get off of that. So now you're on the muscle, because arteries are going through the muscle. They're piercing through different muscle tissue as they're traveling through the body. And so, likelihood you might hit one, you might get around one, not a big deal. It's not going to cause anything really traumatic, but we don't want to linger on there for really long. We don't want to totally occlude the blood flow to a certain limb or something along those lines. Okay. The only other thing too, I wouldn't roll directly down the center of your low back. Okay, it's not. That's too much pressure on the lumbar spine. Directly. So I'm not a big fan of that. Some other people might have different thought processes around that, but I do not recommend my patients to roll directly down the lumbar spine. You can angle yourself off and hit the muscle. So you kind of do one side at a time with like a 45-degree angle, and then you do the other side at a 45-degree angle. That's reasonable. Hopefully that helps.
All right, thank you, Dr. Danielson. And so for everyone who's on this call and who registered for the webinar, we will be sending a follow-up email that'll have the PDF form of all the exercises Dr. Danielson went over, and it'll also have this PowerPoint presentation. So if you are visual people and you like to see the actual contents of the presentation, it will be in that follow-up email, also with Dr. Danielson's contact information if you want to talk to him directly. So the next couple of slides is just kind of pointing to a lot of the things that we actually do at Airrosti. So the next slide just kind of gives a brief overview of the outcomes that we take. So for anyone who's been into our offices, before and generally after we render treatment and the corrective exercise, we always take a survey to number one, see where our patients are coming from, and to make sure that we're not kind of in a hamster wheel of doing treatment. So a lot of our patients have received past imaging, whether it be an X-ray, MRIs. They've been referred to specific specialists for the conditions they're coming in. And a majority, or about half of them, have received prior PT or chiropractic care for the injury that they're in our office for. So we want to make sure that we're not doing the same exact things that they've done before, but necessarily making sure that we get to the source of their problem. So from the inception of Airrosti, we've seen over 800,000 patient cases. On average, we see our patients about 3 to 4 times to get you to total pain resolution. And a really big thing that we love always is that we've avoided over 15,000 physician recommended surgeries. So with surgery comes a whole different situation of having to do rehab. So we like to get to patients before they go under the knife. So going into surgery should always be your last resort. And so from all the patients that we've seen, almost 9 out of 10 people will receive a full recovery from the particular injury that they come into our office for. And of those, 99.6% of them will recommend us to their family and friends, being that even if Airrosti isn't necessarily the place to get your pain reduced or get your pain taken care of, we always want to make sure that we get you to the right place and kind of quarterback whatever you have going on to make sure that our patient is always being taken care of. And so today, Dr. Danielson went over basically back pain, but like I said at the beginning of the presentation, we see a multitude of different conditions come through our offices every single day, whether it be something chronic in nature like back pain or like neck pain, headaches, things of that sort, or it could be something acute that literally happened the day before, the day of, or within a 1 to 2 week span, like an ankle sprain or hamstring pull. A lot of people right now are dealing with carpal tunnel and some shoulder injuries and things of that sort because of having to sit at the computer and at these ergonomically not so posture specific or posture conducive conditions that they've been in. So, and lastly, we are in a network benefit for all of Austin ISD's Aetna Health Plan members. You don't need a referral to go see any of our providers. Dr. Danielson's office is one that's right off of 32nd in Red River. We also have clinics all over Austin and all over Central Texas. And currently our clinics are still open while we're adhering to all the recommendations of the CDC to make sure that we provide a safe environment for our treatment teams and our patients. And lastly, I would like to thank you guys for attending, and Stephanie Hawkins specifically for setting this webinar up for you guys. We have another webinar coming up on the 29th, and it will deal with specifically talking about shoulder injuries and how to prevent those. If you have any more questions, feel free to send them over in the group chat. But if not, I thank you and I hope you have a great rest of the day. And hopefully look out for the registration for the next webinar upcoming.